Dr. Manu Sehrawat, and I did my post-graduation here from this institute, and after that I did senior residency as well. I went to UK in 2017, and since then I've been working there. Currently I'm working as a dermatologist. Today I'm going to talk about how you can pursue a dermatology career in UK. I think everybody know about USA, but UK is always a mystery. At least it was for me. So there are the prerequisites which are mandatory before we can practice as a doctor there in the UK. So first of all, you need a GMC registration. For that, you need an English exam, which can be either IELTS or OET. And then after that, you can do PLAB, which is basically a very MBBS level exam, which has two parts. One is MCQ, the other one is practical exam with, I think, 18 stations, practical stations. Then either or you can do MRCP, which I think at our level it's a bit tough to do, but not impossible. We can do it. Or there is another one, MTI, which is rare in dermatology. We don't get it very often in dermatology, but the other branches we usually get it. Or the other route, they have recently recognized USMLE as the pathway to get GMC registration straight away without doing any English exam or any PLAB or MRCP. So there are two routes to become a dermatologist in the UK. Either you can go through training route, or you can go through non-training route, or a CSER, which we call Certificate of Eligibility for Specialist Registration route. So it all depends what is your long-term goal. Whether you want to become a consultant there, or you want to work there long-term, but you don't want to become a consultant because it comes with a lot of responsibilities. Or you can gain some experience in UK, work for some years and return back. Many people do that as well. So if you want to become a recognized UK consultant, there are three possible routes for that. First is CCT, which is the training route. The other one is CSER CP. I'll talk about the CSER CP and CSER route afterwards. But they're all flexible, but because they're flexible, it's confusing as well. This is the route, which is the training route, or the CCT route, which means completion of training is the preferred route. So for that, you must do 2 to 3 years of core medical training, which is basically internal medicine training. At least 2 years is mandatory for dermatology. And after that, you apply for dermatology training, which is again for 4 years. So this is the flow chart. When you apply there, you can go, if you want to do training, you can straight away join from this level. And after doing 2 years of medicine, you can do MRCP along with the training, and then you can apply for dermatology training for 4 years. But the good thing is that recently they've changed the number of years. So if you gain competencies in less than 4 years, you can again get CCT in dermatology even in 2 years. That all depends if you can complete your competency levels. So they have a portfolio and the curriculum, which you have to get signed off for whatever patients and procedures you do. You get the assessments from them. So this is one of the example I've shown the feedback from which I'm going to get from you if you can. This is one of the example that's how they do their assessments, even for teaching and to improve their system. So for core training as well, there are 3 routes. There is internal medicine, which we all know. There is acute medicine as well. This is something different which is there in UK. I don't think anyone of us will be interested in doing that. The pediatricians can also, from here, they can pursue dermatology later on there. So this is the CSER route. So after your internship, and after internship, 1 year of, if you have 1 more year of experience in medicine field, you can get your foundation training signed off here, and then you join from core training part. If somebody has done medicine and got some, there is a equivalence form available in online, that is alternative certificate for medicine competencies, which we have downloaded. We can see on Google, if you Google that, and you can check the requirements for that. So previously it used to be like 10 acute presentations in emergency, like acute abdomen, acute chest pain. So you have to get see these patients, manage them and present them to the consultant. They will give you assessment, and that's how you complete your medicine competencies there. Now they have changed a little bit. It will be very vast if I start talking about them right now, but this is how it is. After medicine competencies, there is you can apply for dermatology training again if you have that certificate and MRCP. And if you don't want to apply for training as such, you can still do Caesar, in which you will just work as a dermatologist, and side by side you will start getting the competencies, like seeing like 10 patients of skin cancer, 15 patients of psoriasis, like that. You get assessments on them, how you manage them, whether you have done that at the level of your competency, what is required to become a consultant. So that's how it is. In Caesar pathway, you don't have to do any training. This is led by yourself. You have to find out the way. You have to download, and you have to get all the paperwork organized by yourself. There will nobody will be helping you. You will be on your own. It is not structured, and because you will be working as a service provision, so there will not be any scope for training opportunities in this. So you will have to take maybe annual leave to complete your gaps. Like sometimes you need medicine competencies. So you have some people do take annual leaves or study leaves and go to the acute department, do their assessments there and complete those assessments. It is not time bound. That depends on your own speed, your own motivation, and how much you're supported. Sometimes you're not. That all depends on the department, but usually they are nowadays, because they need dermatologists there. There is a huge backlog. It not necessarily be coming from the training route. You can by yourself go to the medicine department, go and see some patients, present them, make a plan and present to the consultant. They will give you assessment. So that's how if you want to pursue as a consultant later on, you have to get medicine competencies. MRCP is not mandatory right now, but if you have MRCP, then most of your medicine competencies are already done. They're tick boxed. Even without MRCP, you can apply as a dermatologist. Yeah, just a degree from here and GMC registration by a PLAB route. You can practice as a dermatologist there. But to become a consultant, you need all these. For GMC registration, you need either MRCP medicine or PLAB or USMLE if you have done. Then you don't need even English exam if you have done USMLE. So this is the most suitable route for people like us. So I would suggest, which I didn't do, to collect your last 5 years evidence, what you have done, all of you have done. Get your curriculum, or collect all your evidence. So most of the work is already done if you get that from here. And then the rest of it, if you want to pursue there, rest of it you can get signed. It is cumbersome, sir. That's why Caesar route is not an easy route to do. Ultimately what happens is your 40% of your income goes in government. So what they do is usually, even if you are not a consultant, you're a staff grade. So I think going through training route is much safer. The difference between people who have done through Caesar and who have gone through training is their confidence level is different, because they get the support, they get the organization and the structure properly if you are in training. But if you are not in training, then you are on your own, you're learning on your own, nobody is teaching you, but you're just doing things by yourself. This is very big thing in UK, which I initially, because the kind of personality we have here is very suppressive. We are not assertive. So the only feedback I used to get was that you're very good in academics, you're very good in everything, but it's just you're not assertive. You need to be assertive and you have to be a good leader. So for being a leader, you need to be assertive. You don't have to be rude, but you need to be assertive in your own things, in saying your things. And that comes with, it is very easy to become a dermatologist there. It is very easy. It all depends how you want to pursue afterwards. So Caesar CP is something between like people who do medicine here in other countries and they have medicine competencies already in MRCP, then they pursue dermatology training there. But they have to do dermatology training there. So this is how it is. Medicine competencies signed off, like alternative certificate of medicine and MRCP, and then you can apply for dermatology training. This is Caesar CP. And only Caesar is without training, you are doing everything by yourself. So there is so for documentation for Caesar, there is a GMC specific guidance for Caesar, and there is another bad British Association of Dermatologists guidance for Caesar. Both of them, they need to be fulfilled. So they are both different. So first, the Caesar paperwork, it goes to the British Association, and then it is afterwards checked by GMC as well. So that's why it takes like 1 year or maybe more than that. All the 3 routes are recognized in UK, but may not be overseas. So that's as I said, that you don't have to be a consultant to practice as a dermatologist. You can practice straight away from here after getting GMC registration via any route, lab or MR. So there are 2 consultants. There is one substantial consultants who have specialty registration there in GMC. The other ones are locum consultants. Without specialty register, being on specialty register, we can work as locum consultant. You can just apply a job after getting GMC registration and work as a clinical fellow specialty doctor, or maybe locum consultant if you know the system. People usually do it after like 6 months or 1 year. They start doing that as well. So according to 2019 statistics, one work time equivalent dermatology consultant per 80,000 of population, they have 17,500 above the British Association of Dermatologists recommended target. So that's the requirement there. There are fellowship opportunities as well, but
this may not be so useful for
not useful, no.
What they see there will not be useful here.
No, we don't. Usually they do more surgeries and all. Some of them are paid depending upon how you get it. So if you're not getting it after CCT, like after your dermatology training, so that's not a paid job. So then you have to pay, and it is quite a huge amount. So that's the usual pay scale after if you join from here after getting the after doing your GMC registration. So if you have like 6 years of experience after doing your senior residency, this will be your pay. You can ask for that. If they give you less, you can fight. They have council tax, they have utility taxes. Childcare is very costly. That will take your more than half of your one person's pay. More than half. USMLE is only recognized as a graduate exam, just for registration, not for practicing. No, they can practice after that because they will get GMC registration. But USMLE ke baad bhi they have to do, usually after doing after becoming consultant or whatever they want to do, after doing some years in UK, they move to either Australia, or they can even practice in Canada after giving some exams. So that is recognized. New Zealand, so except USA, that is recognized everywhere. And even in USA as well, if you have good connections, if you get good connections, You can practice as a consultant directly after working few years in UK. That's also true. It's just your patience, what you want to do. What are the pros of working there? They follow the set protocol and guidelines for every condition, every kind of condition. They have everything written. It is well structured and organized, definitely. Work-life balance. They do give you less than full-time opportunities, like if you have childcare. Even if you don't want to work more than that, without any reason as well. Just like that, you can drop down your work hours to maybe 50% or 60%. And you can do whatever you want to do in the spare time. Locum work is an extra earning and it's quite good. At a consultant level, they will give you like, depending upon like, I think 120 to 180 pounds per hour. Huge backlog, lot of vacancies, as I said. Good amount of annual leaves. So I get 34 annual leaves in a year, except apart from Saturdays and Sundays. So that is quite good amount. Sick leaves are unlimited. I think at least 3 months of sick leaves you will get if you are definitely sick. Not like, but for 1 week you can certify yourself without any GP or anything that you are off, you are sick. After that is separate, and they have study budget as well, which they that is the study leaves are and the study budget is unlimited in training. But if you are not trainee, then the study budget is around 1,000 in a year, which is very less. But then you get more paid more than the trainees there for that period of time. I have a job plan if you want to know what consultant do there. So 5 full-time consultant, they have 5 clinical sessions. Or like us who are like staff grade people, they have 7 clinical sessions. That means morning, afternoon clinics. So one PA professional activity is 1 session of clinic, like morning clinic. Second one is the afternoon clinic, like that, in a week. And rest of them are like meetings, MDT meetings with like plastic surgeons. Sometimes we have every weekly for skin cancer discussion for patients, governance meetings, business meetings monthly, academic meetings, and 2 PAs, like Thursday. I have Thursdays and Friday evenings or afternoons for my admin work. So what we do is, after seeing, like for a patient, for one patient, we get 20 minutes to see that patient, including their past history from the system, and then we'll call them by ourselves. They will sit there. You will take the history. You will examine in those 20 minutes. After examination, you will explain the diagnosis. You will explain their treatment. After that, you will dictate whatever you have discussed, whatever you've seen, your history, your examination. You will dictate on a dictaphone. That will be typed by someone else. That will come back after 2-3 days to you. You will edit that, and then that will be sent to to your secretaries. They will then again do some things, and then they will send it to the GP and the patient. So that's how for one patient it is. Lot of paperwork. No aesthetics. 0. NHS don't pay for aesthetics, and aestheticians are different completely.
They are not doctors.
Anyone can practice as aesthetician there, like here.